Well, good evening and welcome to Local 5 special on coronavirus and the stress on our healthcare system. In the last 2 months, the number of patients in Iowa's hospitals suffering from coronavirus has absolutely skyrocketed. Just look at these numbers that you see here behind me. You can see the mountain of daily hospitalizations. They simply are going up, and there is no sign of that strain on the system letting up anytime soon. So tonight, we're sharing the stories of frontline workers, their spouses left at home worrying, leaders in Iowa's hospitals, and those who have lost loved ones to this terrible virus. Local 5's LAKYN McGee joins us now from the newsroom. LAKYN, you have been in the local hospitals. What did you see there?
Stephanie, I just saw overwhelmed workers, and nurses and doctors in COVID ICUs have seen so much more these past few months. So a MercyOne nurse who has been taking care of COVID patients since March shares what it's like from a nurse's point of view.
At MercyOne,
it's emotionally stressful.
Manda Sundeberg works 14-hour days in the COVID ICU.
It's for the most part very tense. You have a lot of very sick patients, a lot of running around. If you're not helping your patients, you're usually helping another nurse with her patients or his patients. It's just a very busy environment.
So you literally came from the ICU to this interview?
Correct.
MercyOne now has 2 different COVID ICUs. And as more COVID positive patients keep coming in, Manda says she's been in the room as a patient dies.
This is real. This is something that we haven't experienced before. As an ICU nurse, I had never seen before.
And behind these doors lies the COVID ICU.
Kind of a long hallway. It's still lined with red tape everywhere. There's plastic drapes that you have to walk into on one end.
Manda says she's heard people say COVID-19 is not real, and she's here to say this virus is very real.
When you see patients struggling like they are, and you see a condition that you've never seen before, or patients as sick as they are, it's a very real thing.
Stephanie, when I interviewed Manda, she had just gotten off a 12-hour shift. I'm told that's a short shift for a nurse.
It's just unbelievable, these stories we keep hearing. And LAKYN, that was just MercyOne. Will we see from other hospitals tonight?
Yeah, Stephanie, we're going to take a dive into Unity Point coming up after the break.
All right, LAKYN, thank you so much.